All right, for part 2, we're going to go deeper into the respiratory system, and we're going to start by looking at the diseases of the bronchi and the lungs. Now, these diseases are usually more severe than upper respiratory infections because they're getting deeper into the system, which makes it harder for us to use some of our more innate and natural ways to help protect us. We're going to have to rely now more on our immune system. Now, many of these could be life-threatening if they progress, and this is because they do affect your breathing. And in order to survive, you need to be breathing. That's why with CPR, we're looking at the ABCs: airway, breathing, and circulation. Okay, so airway and breathing are super important here. Now, these are often more dangerous in older populations, and there's a couple of reasons why. One is the fact that they lose the elasticity a lot of times in their chest cavity as well as the lung tissue, and so this is going to create some issues. We also see that their immune system starts to weaken as they get older as well. All right, so let's talk about asthma. Asthma is a hypersensitivity reaction. It's going to be an overreaction to something, and in this case, we're looking at an exaggerated immune response where the immune system is kind of going crazy in a sense. This is going to cause constriction of the bronchi, which in turn is going to cause difficulty in breathing because we're not able to conduct the air because the bronchi are constricting, making it harder to get the air through that passage. We see that the patient will have episodes of wheezing and dyspnea, that labored breathing. And one of the main treatments when we talk about asthma is, of course, to avoid the causative allergen. Like if you know that something specifically will trigger your asthma, you should stay away from that. We also see that they might use desensitization to kind of desensitize the patient to those allergens. But the main thing is if you're having an asthma attack, we're going to use some medications. Specifically, would use like an inhaler to help with a bronchodilation, or we also may use an epinephrine pen as well, so an EpiPen. Now, guys, if it's a severe reaction and we've had to use the inhaler and the EpiPen, they also need to receive more medical treatment. And we need to take them in because they may still be being exposed to the causative allergen, and we want to get that taken care of. Now, prevention, what's one way we can help prevent kind of severe asthma attacks? Well, identifying and controlling allergic factors. If we know that something triggers it, then we need to try to stay away from it as much as possible. Now, again, some things are things you can't really stay away from, but it depends on what the trigger factor is. All right, so this brings us to acute bronchitis. Now, this is a type of inflammation because it ends in itis. The thing here, though, with it being acute means that it's going to be a very kind of short term. It comes in, it's pretty severe for a little while, but it does resolve. Now, this is inflammation of the lining of the bronchus, okay? So those bronchioles as we're getting down deeper into the lungs. It is a short term type of infection that follows normally an upper respiratory infection. So it starts up here and then it progresses down. Now, it also could be caused, though, not just by an infection for the upper respiratory, but it could also be caused by inhaling certain fumes, smoke, dust, and even super cold air. Those are all things that can potentially cause or trigger acute bronchitis. Now, symptoms. Symptoms of acute bronchitis include fever, a tight feeling behind their sternum, and that's due to that inflammation that's taking place back there. And they'll have a productive cough. This productive cough may have quite a bit of like mucus to it, and so we do see that these are some of those symptoms. Now, the big thing with treatment, of course, is rest and increased fluids, because a lot of these are going to, again, be caused by viral infections or some kind of agent that is not bacterial triggering this. And so because of that, we're going to just support the immune system. We also may give cough syrup. This is to help with that productive cough because sometimes they could be coughing so greatly that it can cause lots of pain and discomfort. Maybe antipyretics may be used, analgesics, which are pain medicine, okay, but then also antibiotics if there's a secondary infection. Now remember, the secondary infection must be bacterial if we're going to use antibiotics. All right, let's talk about influenza. Influenza is known as the flu. It is a highly contagious respiratory infection. It is a viral disease and it has many strands. Now, the strands that we normally hear of are going to be A and B, but there's also a C and more, like H1N1, H2N2. There's lots of different variants that are out there of influenza. We do see that it can spread by coughing of respiratory secretion. So respiratory droplets are going to be the main thing of how they transfer from patient to patient or individual to individual. Symptoms include onset of fever, chills, and a headache. We may also see back and muscle pain, so those body aches. Hoarseness may take place due to inflammation there in the larynx. Nausea and vomiting, especially if we're looking at type B flu. And also diarrhea if we're looking at type B. So it's not just going to affect the respiratory system. Sometimes influenza can affect other systems as well. Now, what's the treatment? Well, guys, because this is viral, we're looking at it being symptomatic treatment. So we need rest, painkillers, anti-fever medications. So we have analgesics and antipyretics. We may be able to take some antivirals. One of the main antivirals that's prescribed for influenza is Tamiflu. It might help and it might not. It depends on what phase of the infection of the flu that you are in. We do see that there is a vaccine. The flu shot does help. It's not always effective, however, because they're guessing. They are making a prediction, an educated guess, a hypothesis of which flu strains are going to be the problem that particular season. And they are then going to make the flu shot based off of that. Now, they could be wrong and it's not effective sometimes, or it could be right and be very good and very, very effective. Okay, but even if it's only 15-20% effective, that can still help some individuals. Hey, because the flu can be life-threatening. There's lots of people who die from the flu every year. But guys, they're either really young or they're really old. Okay, we don't normally see flu killing those in the middle. And if it does, then that's a kind of awkward or weird strand like we saw with H1N1 back in 2008. Now, there is kind of a thing here where we talk about seasonal flu versus the pandemic flu. Now, before this pandemic, we saw that the last major pandemic was actually a swine flu and influenza pandemic in the 1910s. And so there are some things that we can actually see happening versus seasonal flu that's every year and a pandemic type of flu. And really, we could say this as a pandemic virus. It doesn't have to just be specifically the flu or influenza. So let's look at seasonal first. We see that seasonal flu normally follows some patterns. This is why they're able to kind of hypothesize what's going to be the issue. We may even have immunity because we've had previous exposure to that strand of influenza. Healthy adults are normally at a low risk because their immune system is pretty well adapted and ready to fight, and so it doesn't take them down. They may get sick, but it's not going to be life-threatening. But the young and the elderly are at high risk. Just like I talked about a minute ago, we have the very young and the very old that have a hard time with this. Health systems are available. Okay, the patients who have flu are not overwhelming the hospitals. A vaccine is available. Also, there are considerable deaths, but again, you don't really hear a whole lot about them. They are reported, though, to the CDC because it's important to track that. And there's more of a modest impact. When we talk about it being an impact, this means like economically, socially, in the population, epidemiologically. There's not a huge impact on the world as a whole. Now, with the pandemic influenza or even a pandemic virus, but with pandemic influenza or a pandemic virus, we see that these occur pretty rarely, not very often. We may not have immunity because we might not have any previous exposure. This could be such a different strand, such a mutated and strange strand that our body doesn't know how to react to it. Therefore, healthy adults may be at a high risk. They may be at a high risk of having more severe complications and issues with it. The young and the elderly still are at a high risk. That did not change. The healthcare systems start to become overwhelmed. This is where it creates a problem, because when our healthcare systems get overwhelmed with lots of individuals having one sort of issue like influenza or COVID or whatever we might be talking about, we see that it's going to cause like a ripple effect to occur. So we don't have the supplies, we don't have the resources, we don't have the manpower to take care of even just the normal stuff that would come in, like with heart attacks and traumas and all of that on top of it. So the healthcare systems become super overwhelmed. Vaccines may not be available, and we look with some of that they start to be developed and they aren't necessarily available at first. Deaths are much more extensive and the impact is a lot more severe. And we talk about the economy, when we talk about the healthcare systems, we talk about the population and the public in general, it's got a much more severe impact. The next one we have is chronic obstructive pulmonary disease, known as COPD. Now, this is a group of pulmonary diseases, and the primary cause or risk factor is cigarette smoking. We do see that this is due to an excessive inflammation that's extensive and long-term, that's chronic, and it actually starts to cause obstruction to take place because the tissue becomes so inflamed. Now, there's two common types. There's chronic bronchitis, which is different than acute bronchitis, which we talked about earlier, and emphysema. Now, diagnosis is going to be done by a history and a physical exam. We may take a chest x-ray. We would look at a pulmonary function test to see how well their lungs are working. And then, of course, arterial blood gases, because normally these levels will be low for somebody who has chronic bronchitis and emphysema because it's hard for them to get that air into their lungs and then the carbon dioxide back out. So what are some of the kind of signs or symptoms that we see with COPD? We do see that they have dyspnea, okay, again, labored or difficult breathing. Chronic cough. This chronic cough normally is worse in the morning, but it can progress all day. Wheezing. Hemoptysis, this is going to be where they can cough up blood because due to that chronic cough, it can actually rupture blood vessels in the lungs, which can cause there to be blood in their sputum. It can cause cyanosis, where we have that bluing that we talked about. Weight loss, and the weight loss, guys, tends to be because they are working so hard at breathing that those muscles are burning so much energy due to just trying to help them breathe. They may have a pursed lip breathing that takes place. This is to help push more air out. So they're because they're trying to push more air out. They're having difficulty exhaling. And they also may have what we call a barrel chest. Since they're not able to exhale as much air as what came in, it will actually cause their chest to swell a little bit and be where it looks more of enlarged like a barrel chest. And this is due to that lung overinflation. So guys, treatment for COPD is mostly going to revolve around the symptoms. Whatever symptoms the patient has, those are the types of treatments we may need to help utilize. So bronchodilators are one. Since it's causing constriction, we want to try to dilate the bronchioles. We may also see inhalers may be helpful for this. Anytime we're wanting to get drugs quicker into the lungs themselves, we want to breathe them in. And so these bronchodilators and inhalers give the medication in an aerosol form a lot of times in order for them to breathe it in so that it's more effective more quickly. These are also going to be seen when you do breathing treatments. You see that they may use mucolytics. This is to help break up the mucus that develops a lot of times with COPD. We see cough suppressants, again, to help with controlling that cough. Avoidance of contact with people who have upper respiratory infections, because you're going to be more prone to getting them, and it's going to be harder for a person with COPD to fight them. Also, getting the influenza or flu vaccine can be helpful. Again, it's a preventative measure of not making this worse. And then, of course, you need to quit smoking. If an individual is still smoking and they have COPD, they need to stop. Okay, if they can quit smoking, it'll actually slow the progression of this disease down greatly. It will not stop it because the damage is already done, but it will slow the progression by a lot. So let's take a quick look at the two types when we talk about COPD. Now, sometimes, guys, it can be in the pure form that even though they have COPD, they just have chronic bronchitis, and other times they just have emphysema. But in reality, both of these kind of go hand in hand. They normally, if they have COPD, they have a mixture of these. So when we look at chronic bronchitis, this is inflammation and scarring of the bronchial tubes. Now, the inflammation is so great that scarring takes place. Scar tissue does not act like regular tissue, and so this causes a problem. We also see that they start to have this very thick mucus. And due to the fact that they have this chronic dilation of the bronchioles that's trying to happen in order to help them breathe, we call this bronchioctasis. This is also going to be where the mucus is going to pool in these dilated bronchi, and we see that that creates a foul-smelling cough, and this is known as the smoker's cough. On the other hand, with emphysema, this is increased production of mucus, but this mucus causes the trapping of air to happen in the alveoli. Since it traps the air cannot be exhaled like it's supposed to, and this is why you get that barrel chest type structure. So we have the air trapping. This causes the patient to have more of the pursed lip breathing, as well as leaning forward more to try to push more air out, and that barrel chest formation. So guys, I kind of have an example here. People who are going to deal mostly with the chronic bronchitis, a lot of times they're known as blue bloaters. The symptoms here are the chronic productive cough, the purulent sputum. They may also have blood in that sputum, mild dyspnea initially, but it can get worse. Cyanosis, peripheral edema can occur. They'll have those crackles or wheezings that we can hear when we listen to their lungs, prolonged expiration, and they may be obese due to a lot of that peripheral edema, okay, due to that buildup of fluid. We see that if they deal mostly with emphysema, a lot of times they're known as the pink puffer, and this is due to the dyspnea, minimal cough, increased minute ventilation, so they breathe quicker. Okay, their skin appears more pink. They have their pursed lip breathing that takes place. They have accessory muscle use, so we see certain muscles are going to be used more often to help push that air in and out. They may have cachexia, which is going to be weight loss, hyperinflation and a barrel chest, decreased breath sounds, and tachypnea. All right, so these are kind of just showing you that if a patient has more of the chronic bronchitis, they'll see certain kind of things be more of an issue symptom-wise. If they have more of the emphysema, it's going to focus on some others. But remember, in reality, somebody may have a combination of both of these. The next one we have is atelectasis. This is where there's a collapse or airless state of all or a portion of the lung itself. Now, there's a number of different causes of this. It could be due to a surgical type of pain or fractured ribs, or even a blockage of an airway simply by a mucus plug. But something is happening that's causing that part of the lung to not be able to inflate properly, and so it causes it to almost collapse in a sense. Now, one of the main things that helps with this, especially when we're talking about surgical pain, is getting the patient up and walking. If we can keep the patient ambulatory, okay, that's what ambulation is. We get them up, we get them walking to where they're using their muscles, they're breathing, and especially with the deep breathing, that's going to actually help prevent this from occurring. Again, frequent deep breathing and coughing may be beneficial, and this is one reason why respiratory therapists may come in and they bring you that little machine and they'll tell you, okay, every 15 or 20 minutes, I want you to take that and take some really deep breaths. I want you to push that ball up as high as you can. Okay, it's a visual of getting you to take really deep breaths to help prevent this. We may also see that painkillers may need to be given, and a reason for this is that the pain itself from the fractured ribs or the surgery is actually causing the patient to not want to take deep breaths, so their breathing's more shallow, and this could then contribute to that whole collapsing, and so we want to help with the pain so that they'll take more normal breaths. All right, the next one we want to look at is pneumonia. When we look at pneumonia, this is inflammation of the bronchioles and the alveoli. So we see the bronchioles are inflamed as well as the alveoli. This is due to an infection, and it could be bacterial, viral, or some other type of pathogen. Now, bacterial is the most serious type of pneumonia, but a viral type of pneumonia is actually the most common. All right, so bacterial is more serious, but viral is more common. Now, the symptoms are related to the area and the tissue involved. Now, this is where we look at the fact that sometimes they can have what we call double pneumonia, meaning both lungs are affected. There could be almost just a partial pneumonia where it's lobular, where only one particular lobe is affected. We even say that some individuals can have walking pneumonia, where they don't even show a lot of the different symptoms that are part of pneumonia. Now, symptoms are going to be things like chills, fever, chest pain, and even cough. Diagnosis is going to be done by a history and a physical exam, chest x-rays, and also sputum culture. The sputum culture is going to help us know what the causative agent is of that pneumonia. The treatment is going to depend on the cause. So if it's bacterial, we can use antibiotics. If it's viral, we're going to use more of the stuff that's going to help the body fight, like supporting the body with fluids and rest and that sort of thing. So it depends on what's actually causing the pneumonia to what kind of treatment needs to be given. Now, there is some ways to help prevent pneumonia from developing. Of course, not smoking is going to help. If you're a smoker, you're increasing your chances of pneumonia. Frequent hand washing is important. Again, if we can wash our hands and keep them clean, we could stop the spread of some of this. And wearing a mask when working with fumes, dust, and mold. Because of the fact, guys, when you kick up those fumes, dust, and mold, like say you're in the garage sweeping the garage and it's really dirty and you're breathing in that dust, you could be breathing in bacteria, viruses, or even if we look at mold or fungus, that could ultimately cause you to start to develop pneumonia. Okay, so now guys, if you look here, pneumonia is an inflammation, and you can see that there's actually a buildup of some fluid that takes place, and the oxygen's not able to move and diffuse from the alveoli to the blood like it's supposed to. Sometimes pneumonia is also caused by what we call aspiration. Aspiration is where you inhale something you were eating or drinking, and that can potentially then cause inflammation and trouble as well. Now, a complication a lot of times of pneumonia and some other types of diseases, which we'll talk about in a second, is a pulmonary abscess. Now, this is a collection of infectious material within a capsule in the lung. Okay, so you can see in the picture, you can see that this is an encapsulated area of infection. The lungs kind of walled it off in a sense to try to protect itself, but it can cause some major issues. It could be a complication of pneumonia, like I just said, or tuberculosis. It could be lung cancer or even aspiration of food or a foreign body. Let's say you breathed in and you took something in you shouldn't. Okay, something small that shouldn't have gotten in there in your lung, and it causes an issue. That foreign body starts to be encapsulated and there's infection that's present in that capsule. So symptoms are very similar to what we saw with pneumonia itself. We see that the patient can have chills, fever, chest pain, and even a cough. Treatment may be long-term antibiotic therapy. If it's going to be tuberculosis or even a bacterial pneumonia, we're going to have to use antibiotics. And a lot of times, because infection is present, this is going to mean bacteria is also present. So antibiotic therapy is going to be the first thing that we're going to utilize. Surgical resection of a large area may have to happen if we're unsuccessful with the antibiotic therapy or can't use the antibiotic therapy. So they may have to go in and actually take that piece of the lobe of the lung out that has the abscess present. So let's look at pulmonary tuberculosis, or what we call TB, since that's one of the things that can complicate and cause an abscess. This is an infection that's caused by Mycobacterium bacterium tuberculosis. This bacteria is acquired by breathing air that's infected with it from somebody who has coughed or sneezed. So somebody who has tuberculosis has coughed or sneezed, and then you breathe it in and you potentially get tuberculosis. Now guys, tuberculosis is a worldwide problem. It is actually considered a pandemic, even though you haven't really heard about it before. It's the top infectious disease the top infectious disease killer in the world. Okay? There are lots of people who end up dying of tuberculosis every year. There's been a worldwide effort to try to help control and eradicate this. It has made some headway. It's reduced since 2000. We see that it started in the early 2000s, and up to 2015 there was a 15% reduction in TB infections. And that's not a whole lot, but it was helping also though with the deaths. We see that it was a 47% reduction in the number of deaths. So we're moving in the right direction, but we're still not in control over this. Now, diagnosis of TB is through a skin test. You go in and they insert a little bit of the antigen from the TB, and they wait to see if your immune system is going to respond to it. This is known as that type 4 type of hypersensitivity, where your immune system has a delayed reaction. So the readout of the skin test happens normally 2 days after the injection. Now, if a positive test is done or seen, we do see that a chest x-ray may need to be done and a sputum culture, because some people do have false positives when we talk about the skin test. Now, treatment. Treatment here is an extended antibiotic therapy. It's very difficult to rid the body completely of tuberculosis because a lot of times the lungs do encase it away in those capsules, those abscesses, and it's hard to then have access to them, but it does cause that bacteria to become inactive. The only issue is it can reemerge when your immune system has been compromised. Maybe you have a different infection that's taking place and then the TB flares up. So we still have to be careful of this even with extended antibiotic therapy. The next one we want to hit on is adult respiratory distress syndrome. This is known as ARDS. This is not very common, and we don't really know what causes it, but it does follow episodes of severe trauma. So when severe trauma has taken place, we do see that there is a chance that this can develop in adults. One of the main causes is going to be sepsis. That's what we see kind of is the higher risk factor of this developing. It is also known as shock lung because the body kind of goes into shock starting with the lungs. It happens normally 24 to 48 hours after that severe trauma. It causes acute respiratory failure and it needs the person to be on mechanical ventilation. This is why it is so life-threatening, because if they're not in a hospital setting, they may die before they receive that medical treatment. Even if they receive the proper medical treatment, we do see that there is a high mortality rate with this. Okay, so even if we're able to get that ventilator on them and that sort of thing, we do see a high mortality rate, and we also see that there are some kind of long-term effects of this. The symptoms come on sudden and it causes acute extreme dyspnea. Eventually, it's so labored breathing that they can't breathe on their own. The last thing we're going to talk about in this part of the presentation is sudden acute respiratory syndrome, also known as SARS. Guys, this is one of the biggest emerging types of diseases in the 21st century because it was one of the first ones that we really saw as being an issue. It's a severe, easily transmissible new virus. It's one that people had not seen before. Okay, so it is from a coronavirus, and this might sound kind of familiar from what we know with COVID. It was an unknown type of coronavirus that they were able to identify, and they called it sudden acute respiratory syndrome. Now, this caused the patient to have malaise. They're just kind of tired and blah, chills, headache. They would also have muscle ache, extreme muscle ache, dizziness, cough, sore throat, and a runny nose. Now, eventually, though, because this did cause acute respiratory distress, it could be life-threatening and would require a ventilator support in order to help with breathing. Okay, and so this could become very deadly very quickly if we weren't able to get that treatment. Antibiotics are ineffective against this because it is a viral infection. All right, so that finishes up part 2. If you got any questions, please let me know.